safety net consortium with Carol Westlake is a part of has been around for a while, Carol, but this new website, I mean, is brand spanking new.
It is brand spanking new.
All right,
yes.
so let us learn more about this.
I will be happy to do that. Well, the Safety Net Consortium of Middle Tennessee has been around for about 15 years, and it really is an alliance of clinics here in town, providers, the local hospitals, community groups. I actually work for the Tennessee Disability Coalition, so I serve on the consortium as somebody who wants to make sure that people with disabilities have access to good health care, for example. And the Safety Net Consortium established the Bridges to Care program years ago that was sort of operationalized by the health department. So it really are community members coming together to say, how do we make sure that everybody in Nashville and Middle Tennessee has access to affordable, quality health care? And as a part of that, we have a new website that's called My HealthCare Home. And it really is a web-based service that is trying to link people who are uninsured or people who have who are underinsured, whose insurance may not cover regular health care visits, to a source of affordable quality care. So they have a source of regular care and can, as your earlier guest, Dr. Bell, said, really be well and not have to rely on going to the doctor only when it's an emergency or only when you're already pretty sick.
So you're talking about even preventative
care
and taking care of things before they escalate to a critical situation. How do people get to you? How are you getting the word out? Besides this program, how are people going to find out about this?
Well, we're doing it in a variety of ways. I mean, one is we have pretty deep roots in our community because of the groups that are part of the consortium, and so everyone's trying to share the word. Our clinics are all doing their individual work to try to make sure that people know that they're out there. But our research shows that about half of the people who are uninsured in Nashville don't know that there are safety net clinics, that there are clinics that have sliding scale fees, and that they can really get affordable care. So we are doing things like this program. We are also really trying to reach out to small employers and helping that maybe can't afford to provide health insurance for their employees or their employees' families, and letting them help us get the word out to folks. Because most people who are uninsured, frankly, are working, but for one reason or another can't afford to have health insurance.
You're talking too about a lot of these people that are underinsured.
Absolutely.
Maybe they're working part-time.
Yes.
Or again, working for a small business where they don't provide benefits. So who would benefit from this information? Those underinsured people?
Yeah, and people without insurance. I mean, we think that everybody in the community would benefit from knowing that there are these services out there that they can be linked to. For example, you might have some decent health insurance, but you might not have dental insurance. Some of the clinics that are a part of the safety net are also provide dental services on that same sliding scale fee basis, and so that really is another way. Your teeth really are the key to your health in many ways.
Yes.
And so if you can go to the website and kind of put in the service that you need and be able to find that near you.
What can people get from My HealthCare Home?
They can find out where the clinics are in their community. They can find out what those clinics provide. They can find out what the hours are. In many cases, the website will link them right to that clinic where they can make an appointment, either online or by clicking and making a phone call right then. So it's really a way to get folks simple and easy. Everybody has a smartphone these days, and the easiest way to find those services.
So the services that these clinics affiliated with you, they provide then a wide variety of services, and maybe somebody getting a tooth filling replaced. It could be having their eyes checked. It could be just across the board.
Right. I would say that all of the clinics that are part of the safety net provide kind of primary care, the kinds of things you would get from your general practitioner, right, or your family doctor.
All right.
And that's really what these clinics want to be. Is that regular source of care, right? So that you don't just go when something's wrong.
So almost a first line of defense.
But that you have a relationship with a doctor. It's somebody who you can call, somebody who you know, and who knows you. So disease management, most of the clinics have pediatricians. Some of the clinics have specialists that are on staff. If they are not on staff, there's a part of the safety net consortium called Project Access that can link folks to volunteer specialists who help low-income folks get linked to specialty care when you need a urologist, for example,
Right.
or you are diagnosed with cancer, and how do you get into oncology and that sort of thing. So there's links to those clinics as well.
Will folks receive the same level of care at one of these affiliated clinics that they would from their regular provider?
Absolutely, absolutely. These clinics have top-notch staff, very well-qualified folks who are committed to wellness in this community, are committed to the practice of medicine and really wanting to make sure that people are well. These clinics don't just serve people who are uninsured. Most of our clinics also take patients with insurance. They take them with Medicaid, take them with Medicare, with private insurance. So it's not just a fallback, but it is a safety net for folks who need it.
Terrific. How do people find out more about this then, Carol?
Best thing to do is to go to the website.
All right.
Yeah.
Which is?
Which is myHCH for Healthcare Home, myhchtn.org.
That's terrific. And I want to go back to your roots in the community as we wrap up this segment. You started, you said, 15 years ago. And how did it start, really? It was.
Well, it actually started because there was a national opportunity to get a grant, to get some money to come into our community to try to make sure that we were reaching out to folks who were uninsured or underinsured. And so couple of the hospitals came on, the safety net clinics. Some of them are faith-based, some of them are like FQHCs, they're federally qualified health centers, came together and said, how can we do this as a community? Got some nonprofit folks together, and off we went. That developed a new program. It served thousands of people over the first couple of years. We were able to put care coordinators in emergency rooms. Trying to divert people from emergency rooms was a big part of it.
Well, it speaks to the dedication of so many people like yourself to those people who don't have the access or don't have enough insurance and all of that. So Carol, I think we need to go, but thank you so much for explaining this to us and making us aware of this new
Thanks
website.
for having me.
Thank
Appreciate
you.
it.
All right, we'll be right back. Thank you for watching Community Health Matters. Learn more ways to improve your health at mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.